Welcome back to Casey Cares, Kansas City's nonprofit voice. I am Bobby Keys, and we are broadcasting live, right, Ruth?
We're doing it. We're being safe. Ruth Von Biggest here. I'm so glad that we're able to continue from our respective areas to the metropolitan area. We're following the rules. We're social distancing and being safe. And while it is very hard not to see your lovely face, less than 8 feet from me behind a mic, we're going to do this. So we're all safe and be together.
There's an end in sight. There's a date. How about that? That's a light.
Absolutely. And joining us is one of those people who is out there working behind the scenes with lots of other organizations. We have Qiana Thomason, who is the head of the Health Forward Foundation. Good afternoon. We're so delighted to have you and have just heard your praises sung by a number of people, including David Oliver, who was on our show several months ago, and said, "You've got to have Qiana on. She's just a powerhouse, and she'll tell you all the great things that are going on." So welcome. And tell us more about the Health Forward Foundation.
Absolutely, Ruth and Bobby. Thank you for having me on, first of all. You're breaking up the monotony of me staying in my cave under our stay-at-home orders in my home office. So I'm happy to have such a welcome diversion. So the Health Forward Foundation is a public charity foundation, and our mission is to provide leadership, advocacy, and resources that eliminates barriers and promotes quality health for the uninsured and the underserved in our service area. We serve all of Kansas City and 3 counties in Missouri, Jackson, Cass, and Lafayette County, and then 3 counties in Kansas, Wyandotte, Johnson, and Allen County. We serve or partner with around 200 organizations, nonprofits a year, and we grant make about $20 million a year to nonprofits for healthcare services and ancillary services that complement the promotion of quality health and the elimination of barriers. And since we began grant making in 2005, we have awarded approximately $300 million in the Kansas City area. So that is who Health Forward is.
Wow. And just so people understand, you mentioned you give grants to nonprofits that are geared towards health.
Correct.
Or do you help people? Oh, okay.
Yeah. So the nonprofits we grant to are actually healthcare providers, some in our safety net category that includes federally qualified health centers, health center lookalikes, also includes smaller neighborhood clinics, as well as in our mental health category, it includes community mental health centers, community behavioral health centers, domestic violence shelters, child and family serving organizations as well. And then in our Healthy Communities round, we fund a whole host of organizations that provide services that aim to address what's called the social determinants of health. Those are issues that have more to do with our health outcomes of healthcare itself. Issues like socioeconomic status, your education, your income, your access to transportation, your environment, violence. So Healthy Communities funds all those types of organizations as well.
That's interesting. I could go down a whole rabbit hole when it comes to the socioeconomic and those types of issues that affect health that people don't think of. Mm-hmm. Whether, like you said, your environment and the community, your housing. People think, oh, it's just cancer or whatnot, but there's a lot of other things that people don't realize that affect your overall health, right?
Absolutely. So only 20% of our health or our health outcomes are by and large attributed to behaviors, our economics, and our environment. Only 20% is attributed to the medical care that we receive in the genetics. So of how, what we're made up of. So actually, we're talking about 80% of our health outcomes are based on non-clinical, non-medical factors.
Wow.
That's kind of scary.
Huge.
And that's kind of scary in a way.
Yeah, absolutely. People don't think about that. Nobody preaches about that. You don't worry about the psychological stress that a kid's going through, or with everything that's going on today.
Yeah.
That's a lot of stress that kids are taking on, and that ultimately is the stuff that affects your health. That people, things of that sort. Or maybe I'm just going down the wrong path.
No, you're exactly right. You're exactly right. And I think in our current conditions, under the COVID-19 pandemic, this is exacerbating existing struggles that families were already having and individuals around socioeconomic status. And so this is widening those gaps that were already influencing health more than healthcare itself.
So if we're seeing that impact, you were already dealing with a very full basket. Mm-hmm. Now it sounds like you're describing a basket that's overflowing and needs 3 or 4 more to catch all of this. How is your foundation working and responding to the sudden place we all find ourselves in?
Sure. We're working in very close partnership and listening and engaging very intently, very compassionately, and very strategically as well. So, of course, COVID-19 has affected our entire economy and all the organizations and individuals and families that make it up. We provide and partner with our grantees, who are mostly nonprofits. And the nonprofit sector has been turned upside down with respect to, of course, their ability to bring in revenue, the patients and clients that they are serving oftentimes aren't able to access the care that they need, or they aren't able to provide the services in a way that they are accustomed to. So it's introduced all manner of disruption to our grantees. And once we thought about the very low-hanging fruit on what we can do immediately at the foundation to support our partners, it was to get advance payments out the door. If anyone who already had an approved payment, we got that advance to them for grantees that had payments scheduled through June. We converted all existing grants to core operating, meaning they could use it flexibly, however they needed it, which was really important because typically we see grants come in for certain programs and certain services. But in times like these, it called for more flexibility. It's not business as usual, and we wanted our grantees to know that we're here with you, and we want you to remain viable and to be kept afloat, and so use the funds how you need them during this time. We also relaxed a lot of reporting requirements for our grantees, knowing that that's the last thing that they need to be focused on is documentation and administrative. We quickly also looked at our budget and determined what we could reallocate in light of the crisis. And so we have reserved up to $3.7 million, which is called our COVID-19 Community Resiliency Fund, to support key stabilization, recovery, and resiliency of our service area. So that includes, my dog will be barking, I'm sure, throughout this entire conversation. So I apologize for that.
That's what's great about having the show. Even our animals are staying where they need to be. Exactly. And that is part of the conversation, right?
So that's Layla in the background, and I think she's annoyed that we're home so much, to be honest with you. But in any event, our $3.7 million that we've reserved includes a lot of support and funds to safety net medical providers, our federally qualified health centers, places like KC Cares, Sam Rogers, Swope Health Services, Vibrant Health on the Kansas side, Healthcare Coalition of Lafayette County in Lafayette, Missouri, and then the Community Health Center of Southeast Kansas. It also includes some smaller organizations and neighborhood clinics also includes community mental health centers, as well as a host of other essential services. We've partnered with the YMCA of Greater Kansas City to provide child care services for workers of our safety net medical and behavioral health providers, with a priority for low-wage hourly workers, knowing that the whole child care dynamic is also causing folks to struggle financially. It was unplanned. They can't get to work if they don't have child care. So this was a barrier that we wanted to remove to recognize the support that our frontline public health professionals need.
It's amazing that you all have been able to come together that quickly with staff everywhere. And how did you make this happen? I mean, it's been very impressive to me and Bobby, I don't know how you feel, please chime in, that the various foundations in the community have been able to just, do this quickly. I mean, it wasn't like we had months out to plan.
Yeah, you're certainly right about that. Well, first, I need to give a lot of kudos to my colleagues at Health Forward. The team has been amazing. We have divorced ourselves from business as usual, have been thinking in unorthodox fashion, and have been really been as nimble in our thinking and in our planning as possible. I also want to underscore your comment about the collaboration that is occurring amongst funders, among public-private organizations who have all come together to pool our resources to support Kansas City stabilization and recovery. So we were one of many contributors to the Kansas City COVID-19 Rapid Response and Recovery Fund that the Greater Kansas City Community Foundation administers. I also worked very closely and collaboratively with my peers at the Reach Healthcare Foundation, at Wyandotte Health Foundation, at the Hall Family Foundation. And so we have been working in warp speed, actually partnering on how we're going to fund stabilization of the nonprofit sector in this community. And so it's been refreshing to see, and I know that with the commitments we've made and the success that we've had and the results, we will continue this collaboration past this inflection point for sure.
Yeah, I think that's one of the beauties of what's happening. If you can look at it like that, it is forcing so many different people and businesses to think a different way, to become more familiar with the digital world. It definitely pushes you out of your comfort zone. And one thing it's highlighting though is the importance of healthcare. Do you see more of a society that's going towards like a one-payer system, or where there's just way more concentration in the healthcare? It's like obviously everybody needs this. Look at an event like this. There's so many people that are caught off guard.
You're so right about that, Bobby. I think every crisis, in my view, really masks itself as a crisis, and it's really what I see as opportunities. And so the opportunity that we have before America and internationally is to understand the fragility of our healthcare system and understand how important access to care is. And so this is our opportunity to rethink policies and to rethink funding mechanisms and relax certain issues that kept providers from operating at the top of their license, non-physician practitioners, all of that. So everything needs to be looked at and explored with respect to optimizing health and ensuring healthcare access. One of those is Medicaid expansion, which is at issue both in Missouri and Kansas. Both of our states are one of 14 states that have not expanded Medicaid, meaning 36 other states have. They have taken advantage of federal matching dollars to expand Medicaid to ensure that everyone in their states has access to health care. And so those decisions are before us right now as a bi-state community. So in Kansas, the legislators they're on break right now, of course, because of the crisis. But when they resume, they hopefully will continue discussion about expanding CanCare, that is the state of Kansas's Medicaid program, through the legislative process. And in Missouri, it's actually up to the voters. So Health Forward Foundation has really been on the vanguard of working with the Healthcare for Missouri campaign to ensure that all Missourians have access to health care. And we are proud to say that we should see that question on the ballot in November 2020. So it's important that individuals take this opportunity to look at what's the low-hanging fruit out of this crisis. What can we make sure happens so that we don't see access to care challenges? And we have seen them in this crisis. There are hundreds, if not thousands, of individuals who are unable to get tested. And our public health system, just here locally, our health centers are doing the best they can, but they're unable to test, by and large, anyone who's not already an established patient. So that means that someone does not have an assigned health center or primary care physician, they're locked out from testing. So The reality is that Medicaid expansion opens up that access and gives folks the care they need to make sure that they optimize their health. So I can't understate at all the opportunity that we have coming out of this crisis to let's think systemically and at a policy level in terms of what needs to be done.
Qiana, we're so thankful that the Health Forward Foundation is here and that you're leading the charge and give people hope, and nonprofits particularly out there that are dealing in these areas. Please reach out. Please go to healthforward.org. Qiana, thanks so much.
Thank you so much, Ruth and Bobby. Appreciate talking to you.
Inspired by Ewan Marion Kaufman, the Kaufman Foundation believes that every person, regardless of their background, should have the opportunity to learn, to take risks, and to own their success. Working together with our Kansas City community and beyond, we take on approaches that break down barriers, providing people with the necessary skills throughout life to make or take a job and ultimately give back to their community. By listening to the communities we serve, tap into our learnings and relationships, and bring everyone together to build and support programs that improve education, boost entrepreneurship, and help Kansas City thrive. Learn more at Kaufman.org.
COVID-19 is a severe lung infection. Trust the American Lung Association for science-based public health information, especially for the 36 million Americans who live with lung disease. We have resources to protect your lung health, access expertise from medical professionals, and peer-to-peer support through our online communities. Visit lung.org for daily updates or call 1-800-LUNG-USA.